Climate change goes hand in hand with increasing environmental health risks, from water and air pollution to extreme heat to food insecurity. By paying attention to changes in the environment, governments and public health officials can make decisions that will improve people's health outcomes. For more on this, we're joined now by Helena Chapman. She's Associate Program Manager for Health and Air Quality Applications in the Earth Action Program with NASA's Earth Science Division. Thanks for taking the time to be here.
Thank you for this opportunity.
So tell me a little bit about this relationship between climate change and environmental health. How are the two interrelated, and why is this important to look at?
Earth scientists are examining how our Earth is changing, the different systems when we think about the atmospheric, the terrestrial, and the aquatic ecosystems. And those have living organisms such as humans, animals, plants, among others, and how that can affect. So as we're seeing increased temperatures, increased precipitation, deforestation, we're seeing that those elements can actually impact exposure to harmful hazards, including vector-borne diseases. And so that's when we start thinking about the One Health concept, thinking about a little bit more holistically about how we view health.
Can you tell me a little bit more about One Health, like how this idea came to be and what it is?
So the One Health concept really has a two-part approach. The first is looking at the interconnectedness between humans, animals, and the environment. There are these links, and one will affect the other. The second part is really to look at a call to action to work outside of our silos. So earth scientists working with health practitioners, working with veterinarians, working with the agricultural sector, the ecological sector, the tourism sector, working across all of these sectors to really better understand how these changes to our Earth systems are impacting human and animal health.
So the information that scientists are gathering about, Earth's health, human health, plant health, animal health, these kinds of things, then that information is useful to policymakers and to public health officials for them to be able to make decisions. It seems like an awful lot of information. How do you figure out what information is useful and what's just too much and might make them feel sort of like they're drowning in data?
The One Health Joint Plan of Action 2022 to 2026 really lays that out. It was launched last October, and the sixth action track actually states integrating environment into One Health. And that's going to be really important because health practitioners do not have all the answers. Really, no one discipline has all the answers, but being able to collaborate across disciplines, we can provide that information. And earth scientists, as they're studying how the Earth is changing, have been able to develop robust models and algorithms for disease forecasting. So if you have the information for 6-8 weeks ahead of time of an at-risk area for potential cholera or malaria outbreak, you can provide that information to those who are the urban planners, the policymakers, the mayor, or the leader of that community to be able to make some of those decisions to protect health of their community.
Yeah, all of this seems to fit really well with this year's theme at AGU of wide open science. Can you talk a little bit more about how open science really dovetails nicely with what you're talking about in terms of the One Health?
The open science to me is being able to make the information available to the globe, whether that is a scientific research finding or if it's a public health message. And from a public health angle, we can see that information being translated appropriately to the community who needs that information. The World Health Organization has identified 13 urgent challenges in 2020. Of that, one of them is harnessing new technologies. So being able to adapt some of the information we have and data resources from the earth science community and adapt them to other communities, other ways of being able to analyze data. And the second part, another urgent challenge, is actually being able to build public trust. And that we've seen throughout previous pandemics, such as Ebola and COVID, where the infodemic has been a challenge to those who are working on the ground. And so how can we bring some of the information from the Earth observing satellites to validate the information that we have, integrate it with some of the public health surveillance data, which have limitations in itself, and to be able to really understand what is a disease burden or the hazard burden for that area, for thinking air quality, for example, to be able to provide accurate and prompt health messaging for those communities and for those leaders who are making decisions.
Helena Chapman, thank you so much for your time today.
Sure, thank you.